This show is all about interviewing interesting people and learning. He is a world-renowned facial plastic surgeon. He has hundreds of thousands of followers. His videos get millions of views on social media, and people from all over the world travel to his clinic in Spokane, Washington to see him. Dr. Cameron Chestnut is at the top of his field, and that is why I wanted to have him on my show. So Dr. Chestnut is here. Thank you so much for coming on. I really appreciate it.
Well, thank you for having me very much. Honored to be here.
You came to my attention just because you're putting videos out there about facial filler and specifically the problems with it. And we see it quite a bit just here in the Valley. A lot of women, they're overfilling their face. Before we dive into that though, I just want to ask you, why did you get into plastic surgery and specifically facial plastic surgery?
Going in medical school, you have lots of options as to what you want to do. I just tended to gravitate towards things that were very 3D spatial, creative, things that allowed me to use the artistic side of my brain, and that really led me down the route of different types of plastic surgery. Even orthopedics has things in it like that, but I really liked the creative aspect of it. There's a lot of neuroanatomy that goes into how we interpret faces and things like that. There's a lot of intricacies to those nonverbal types of communication and emotion. That's really what led me to ultimately faces.
You studied at the University of Washington, did also study at UCLA as well. So then you were, the Beverly Hills, Los Angeles area, but your clinic is in Spokane. So tell me about the decision to set up your clinic in Spokane.
I grew up in the Pacific Northwest area in Coeur d'Alene, Idaho. So my practice is actually in Spokane, Washington, and in Coeur d'Alene, Idaho. And I really wanted to have this almost wellness retreat type of practice, sort of if you build it, they will come. And I moved back to the area that I'm from, and I built a beautiful situation where patients travel to see me, like you were saying, from all over the world. They're here for about a week. They're prepared before they come pretty elaborately with a pre-operative regimen that I use, and then they stay for a week, and I get to put them through a post-operative recovery protocol that is very wellness and sort of like biohacking focused, and people are staying on the water in these beautiful places, and it's a really unique experience here.
I've been to Coeur d'Alene. It is absolutely beautiful. So you don't do rhinoplasty, you don't do noses, you're doing the face and a lot of facelifts, eyes as well. Why no rhinoplasties?
I'm big on diving miles deep into a very narrow space. And for me, that's sort of what I would call facial rejuvenation types of surgery or aging face surgery. I'm doing things that are rejuvenative, not transformative. I'm not creating something that was never there before. Rhinoplasty draws that line quite a bit, where when people are doing rhinoplasty, they're often seeking something in their nose they never had before. It's less aging related and more just transforming into something that they've wanted. And it's totally reasonable in some circumstances, but it's just not what I've gravitated towards.
You hear, especially women in their 50s and 60s, and even men too, you hear them say, I don't feel like I'm this age. I'm in my 40s. I don't feel like I'm in my 40s. I think when you get to that point, you want to maybe refresh if you have the means to do it, right?
Right, and you're speaking, this is my patient population, and there's some gravitating towards like attracts like, but my patients are very wellness focused, they're very fit, they're very active, they're doing all the things from even a metabolic standpoint to be anti-aging, to control their inflammation and their oxidation, but at some point there gets to be this decoupling of that, and just as you said, it's the most common thing I hear is I just want to look how I feel inside. I want those things to be matching up, and that creates cognitive dissonance when it's not there. And so Ellen, I love creating that. That's what I want to do.
Yeah, that's the thing. I mean, you're helping. You don't want someone to look completely different. And I think those facelifts that now maybe those folks were kind of like the pioneer of facelifts. Maybe they're like 80 now, but you know what I'm talking about, the real stretched skin, and it's just not a good look. But I mean, that's a very different technique than what is done today.
Completely, and you're nailing it. You still see what you're talking about now. That's definitely still the prevailing types of techniques, just because it's really difficult for people to get out of that thing that they were taught. And as you mentioned, I trained in Los Angeles, and I saw a lot of different people do things a lot of different ways. And instead of just grabbing onto one way as the only way to do it, I took more of a mindset of, well, let me pick out sort of the things, the best parts of all these, or what I resonated with, or what I agreed with. And, I've been in a constantly evolving practice since then. My fellows and I, as we're working, it's always 1% better. It's always 1% different. What are we going to do to improve each time? And that's the evolution that's changed, in the past, as you're saying, the people in their 80s over the past, 30 years, whatever it's been.
So what is that facelift called versus, I'm assuming, the deep plane facelift, which is what, is kind of, you're hearing a lot more about nowadays. Written up in magazines now. Kris Jenner, everyone's talking about her right now. The deep plane facelift versus what I'm assuming is just kind of the superficial topical. I don't know. You describe it.
Yeah. The original facelifts were just on skin, basically just pulling on skin. And that's what most people mimic with their fingers when they're saying that they need a facelift. So that was kind of like Gen 1. And then 2.0, the second generation, focused a little bit on the layer underneath the skin, which is a fascial layer, muscles and fascia and fat pads. And it separated the skin away from those fat pads, which it's not meant to do. There's really important blood supply connections there. And then it would grab the top of those fat pads and muscles and try to pull them tight. That's the most common one that you'll still see today. That's what a lot of people are thinking about when they see the older school facelifts. And then the 3.0, the evolution from there has been to go underneath the fat pads and the muscles where they've actually started sinking, leaving the skin still connected to them, which is really important for a natural look, and then lifting up kind of the actual structure that fell. And that's the deep plane that you're talking about. If we really get into the nuances of it, that is quite different now than where it started too. We have been progressing that procedure, making it better, accessing it for different ways. I have ways that I'll access the deep plane from just a small incision in the temple for somebody who is a little bit younger, say in their 40s, and they're noticing those first signs of aging, and I don't want to put the traditional facelift incisions around their ears. I'll go from a very small access in their temple and still be able to access that same deep plane. So it's this constantly evolving, progressing environment. And interestingly, things like social media that you mentioned at the very beginning are driving that faster. It's making patients more aware of it. It's helping doctors see other people's results to drive them to want to do better. And so it's an interesting time to be practicing, for sure. Very exciting, especially if you're on the innovative, progressive side.
Yeah, no doubt.
So we now have an explanation of the pillow face phenomenon, which is that filler does not just dissolve or metabolize over time. It in fact migrates or spreads to other areas of your face and continues to cause tissue expansion.
I'm Dr. Chestnut, and in my field of facial plastic surgery, I have been swimming upstream on the topic of filler for nearly a decade. I'm thrilled to see that things are finally starting to turn and people are starting to understand filler better. As a surgeon, I see filler present in tissue for decades.
Okay, so filler. A lot of women, a lot of men who maybe a facelift is not in the budget and maybe filler is. Is Botox filler? Talk about that.
Yeah, at a very basic level, I just want to say that I'm not anti any of these treatments. I'm not anti-filler. I'm not anti-Botox necessarily. I'm really just pro knowledge and use about them. And partially, like you're saying, Ellen, is for some people, that's going to be the only thing they ever do. And that's fine and that's great. But we just want both the patients and then probably more importantly, the injectors to understand the products that they're using. And so Botox and filler are different. And that's a very fundamental question and knowledge point. Botox is a brand name of botulinum toxin A, of which there are a bunch of other brands that people might have heard of, like Dysport and Xeomin. And these go in the muscle and they relax the muscle so that when you frown and make your frowning muscle, you can no longer make that face anymore. So they take away a little bit of our muscle of facial expression, and we can't make the wrinkles that form because of that force that's placed on the skin. So that is all the Botox-like agents. Fillers, on the other end, are this class that largely are made out of hyaluronic acid, but there's other types as well, like Sculptra and Readiness, that are different than hyaluronic acid, but their objective is generally just to add volume to the face. And they do so generally by using a gel form that's injected, and that gel goes into fat pads or muscles or wherever it's placed and adds just bulk volume to the area. And we see so much of these because they are very prevalent. You'll find in your world, in the Phoenix area, quite literally, probably 5 per square mile places that you can go get these types of procedures done. They're everywhere. It's prevalent, it's commoditized, and it's very, very easy entry point with very seemingly low consequences to do that. So you'll see it everywhere.
And the other thing too is, I'm assuming there's a lot of bang for someone's buck. If someone is injecting this, they're going to make a lot of money in a very short amount of time.
That is the prevailing thing. That's why you'll find people from all realms doing this. You'll find, depending on the state, there's different state laws, but you'll find nurses injecting it. In some states like Idaho, you can have a esthetician inject. You'll have doctors, dentists, doctors from all specialties, some from the core 4 cosmetic specialties, some from outside. People from everywhere are flocking to this because they feel like there's, cash, there's good money in it versus having to bill insurance. But there's a little bit of flawed logic to that, because you have to be good at it to make that worthwhile, because if that person is coming back to you and follow up and they're unhappy, well, then you're unhappy, and it takes more time. And there's a lot of things that go into why a lot of people come in, they're a flash in the pan, and they disappear afterwards. It's really, really common for that to happen.
Just the 1 to 2 years that it is stated to last. I also see that filler migrates. It causes a tissue expansion effect. So it's in places that it wasn't meant to be, and it's stretching out that tissue over time. We know this has been confirmed with imaging studies. We see it on histology studies, and I see it in my surgeries all the time. We also know that filler does not magically just go away with dissolution as it's stated to do. You can't just put the enzyme on like a magic wand.
The thing too that you do here is that filler, Botox, anything that is injected into your face will be absorbed by your body. And you, in some of the videos that you have put out, you have said filler will last decades, and you see it when you're cutting people open.
Right, and this is where a lot of that messaging comes from in my journey to be pro knowledge about these. Is it's been commonly thought that filler lasts 6 to 24 months. Sometimes you put it in, your body breaks it down and absorbs it, and then you need to get more. That's been taught for well over a decade, going back, 20 years for some of the products. That's how long they're lasting, more than 20 years. The issue with that, though, is that was based off of these FDA trials in the United States where the filler was put in and they looked for a degree of correction. And then when the degree of correction went away, it was assumed that the filler had gone away. But that's not what was happening in reality. It's that the filler was migrating, meaning it was put here, but it moved around, which makes sense. It's a free-floating gel in our face that's contracting muscle.
You've even described it as glue when you were seeing it in someone's face, when you were lifting up someone's facial tissue, when you're performing surgery. It's like glue. It's not going away. It's lasting.
Right, and yeah, these different fillers have different properties on how they're going away. And it is really this education for, like I said, patients and injectors to both understand how it's working, that it's not going away in the 6 to 24 months that were sort of shown in the FDA trials for correction, that the filler, although it's maybe not correcting in the same way, is still physically present in our face. And that has been a big paradigm shift that has been very slow to adopt for many reasons. You can imagine that from an economic perspective, as an injector who relies on serial treatments, knowing that you don't need those serial treatments as much, that could be problematic. And then there's just the way that this information is coming out. And I see this in surgery all the time. So I see it we'd say in situ, in the tissue, in place. I see old filler. In the last week, I've seen filler that was 20 years old, which goes back to the early first fillers in the United States. I saw some yesterday that was 6 years old. That was still very, very, very present, that I was removing during surgery. And so there's seeing it in tissue. We know that directly. We can see it on histology studies, meaning biopsies of skin in areas where maybe there's a skin cancer in the area where there was recent filler or old filler, and that shows durations up to 13 years. We can see it on imaging studies like MRI, showing that it's been present for years beyond what we would expect. And so we know that it lasts for decades. It just takes a paradigm shift in the people that are injecting it to look at it as a more permanent type of implant and to treat it that way, knowing that you don't need to keep topping it off, because if filler's present for years and it keeps getting added to, we are just overinflating the face over time. And this is what you see. This is what you were talking about at the beginning of the show. Walking around downtown Scottsdale or LA or New York or any fill in the blank, any large city, anywhere, you're going to see this sort of slow distortion happening over time. And there's a name for that psychologically. It's called a perception drift. It took the patient years to go from their normal to these baby incremental changes over time that led to what ends up being quite out of normal, and it maybe a friend or they see an old picture of themselves kind of points this out to them, and there's this sort of sudden aha realization that like, oh, I've drifted. I don't look anything like I did at the very beginning, and this is the phenomenon that we're seeing based off the misunderstanding in the first place.
You just put up something recently that Sculptra, for example, claim is that it builds collagen, and you're saying no, it's creating a foreign body in your face.
Yeah, and this is one of the ideas of like gluing things together, because Sculptra does create collagen.
Yeah.
But we have to remember that on some ends, scar tissue is just pure collagen, right? So it's sold as this really positive thing. And it's not, again, I'm not against Sculptra. I'm not saying it's all bad at all in any way, shape, or form, but I definitely see issues. We can imagine, like I was describing at the beginning about, these different areas of the face that we're working that are meant to be the just separative part so beautifully, like the pages of a book. And then you put something like Sculptra in there and it glues those pages together. It makes it very difficult to separate them. That is the collagen formation that's forming as a response to these. That would be a class called a biostimulatory filler, of which there are others they're a bit different than those gel type fillers. They're meant to create this reaction that builds collagen. And again, not being against it, but just understanding what that's doing in the long run and doing that over and over again. You can see on my social media images of almost what it looks like intraoperatively to see these collections of matted down collagen, which are almost like weld points or scar tissue underneath the face from these repeated injections. And you can imagine in a very dynamic tissue like our face that needs to move and animate and give emotion off, that those types of bind points or those types of fibrosis or scarring create different feels, and they don't allow the normal emotion to happen, the normal expression to happen. People feel this. I had a patient yesterday telling me this. I had Sculptra, and now I feel it when I smile.
Yeah. If someone has gone like too far, for example, and you do see it, you talk about pillow face or you see it on television. I know Kristen Davis, and she even admitted to it as well when she came back, Sex and the City, she did the reboot and everyone was going, what did you do to your face? You were absolutely stunningly beautiful. Can you dissolve it? Is that possible? And what are the next steps?
Yeah, this gets a little bit into some hot topic territory, a little bit, because it depends on the filler that you had. The most common ones being the hyaluronic acid probably deserve the most conversation, and because those can be sort of the most distorting over time because they're so easy to over volumize with and keep adding and adding and adding. And there is an enzyme called hyaluronidase that we do make naturally because we have hyaluronic acid in our skin as part of our normal structure, and we recycle it and turn it over. We do so much less with age. We lose our hyaluronic acid. And so adding exogenous or injected hyaluronic acid, there is an enzyme that we can inject around that to get rid of it. The issue with that is we have a large amount of the gel that we're trying to put an enzyme in to dissolve, and it often takes a lot of that enzyme to get rid of the large amount of gel that we have there. And we have to remember that that enzyme doesn't know the difference between the gel and our native hyaluronic acid in our face. This is where it gets very, very controversial because some injectors will say that there is no evidence whatsoever that injected hyaluronidase, the enzyme, breaks down our native hyaluronic acid, that we can't recover from it. And that's most commonly the situation that I see. But I have undoubtedly, without question in my practice, seen patients who've had issues after the injected enzyme, especially in large quantities that are very close together, just kind of overdoing that enzyme a little bit. But that's often what's necessary to get rid of their filler. And so again, not to get too into the controversy of that, but my preferred mechanism, or what I just tend to do as part of my practice, is I will take filler that's present as part of another surgical procedure, and I will manually remove as much of it as I can, sort of when I'm in the area for the surgery that we're already doing, get rid of as much of it manually without using the enzyme. And then if I need any extra removal afterwards, then I can use enzyme, but use much less of it in a very focal way. I can quite literally see the filler that I'm putting it in.
Wow. What about lips? Because lip filler is, you see that a lot. The duck lips, that's kind of a phenomenon too around here. I mean, but I'm assuming it's the same types of filler that people are putting in their cheeks and whatnot. They're also putting in their lips too. Same thing, same kind of controversy as well if you're trying to dissolve the lip filler if you've gone too far.
Yeah, lip filler is an interesting one. It is the same types of fillers, often the hyaluronic acids predominantly. And lip filler often, for me, crosses over into that transformative area sometimes. And there's no hard rule around this, but generally, let's say if somebody in their 20s is getting lip filler, that is very akin to probably being more transformative than it is rejuvenative, because that 20-year-old, 20-something-year-old probably hasn't lost that much volume in their lips. It would be akin to getting like a breast implant, right? Like it's just making something different than it was in the first place. There is some volume loss in our lips as we age, but that's only part of a more complex equation. All the fat pads in our face as they age, they don't just lose volume, but they also shrink and redistribute. We can all think of how that happens with basically every fat pad that we can think of. And so that's where filler as a sole strategy for aging, if that's the only thing we're focused on, it gets flawed. It can only do so much because the volume loss is a very, very small overall part of our facial aging.
Yeah.
And lips fall perfectly into that paradigm.
Yeah.
We can see what your metabolic age is. We can see what your genetic age is, but that doesn't always align perfectly with what we're looking like on the outside. And that's the energy. That's like a cognitive dissonance. It creates a mismatch, right? They are linked together. And the things that we can do every day or that we should be doing every day are really, when we get into the holistic part of things, these are metabolically focused, right? These are what's happening with your nutrition, your physiology, what's happening with your inflammation and oxidation standpoint.
The education that you're doing right now, I think it's phenomenal. And I've learned so much, and I'm so glad that you are getting that information out there. And I do hope that folks learn and log on and find your social media pages, because again, we see it every day in our daily lives here in the Phoenix and Scottsdale area. And also too, I mean, just in general, I think folks can also learn a lot about your practice and what you're doing quite a bit differently than other plastic surgeons too. And you know, you're not putting people under general anesthesia, which is very different, I think, than what you probably would imagine. I just wanted to read off some of the other videos too. What causes eye bags? Does stress age you? Why filler migrates? When to never get Botox? What you would do in your 30s instead of filler, which is fabulous, right. I think too. Again, it's like you're recommending some other things to do that could help in the long run.
Absolutely. And I really love to focus wholly. So like, spoiler alert on some of those things to do in your 30s, it's really more systemically focused often than just like what's happening on the face, because our face just tends to be a reflection of what's happening metabolically or systemically in those situations. So there's a lot of outside benefit to it as well.
I'm assuming your practice has dramatically changed because of social media.
Absolutely. I mean, I say that all the time. I'm so grateful in some weird way, because it takes a lot of effort and energy. As you've seen, I put a lot of educational effort into it. It takes time, it takes energy, but I would never be able to have the practice that I have. It's a worldwide practice, and it's really based off of before and after pictures. That's where it comes from, and videos and things like that. People can quite literally see what happens. And it's like you're saying, it's different than what they'll see in a lot of other places. And it's driven by results, and all of those other things are supplementary to it. But somebody in Sweden or Singapore would never see that if it weren't for social media. So it's a, you know, it's a beautiful thing.
Yeah, back in the day, you know, you'd go on to like a website, and that was really kind of all you could do. But now there's so many videos too, where you have like, that's your testimonial, and people are willing to, first off, admit that they've had plastic surgery, which that's like, wow, oh my gosh, you know, when when we were in our 20s, nobody admitted that they were doing stuff at all. And now people are not only admitting it, but they're going on camera and not only vouching for your work and other surgeons' work, but showing people the actual work that's been done, which is phenomenal.
I'm incredibly grateful for those people, as you would imagine. And well under half of people are willing to show their photos usually. Most of my best work will never be seen, but that's fine. It's interesting though, because a lot of the people that are willing to show, that's how they found me in the first place. And it's almost a pay it forward. I have very, very, very tight relationships with my patients. It's, I guess, one of my personal values that I thrive on those. And that really helps kind of the whole sharing of that as well, is that, you know, I know everybody by name. I still talk to most of them. It's a beautiful relationship.
You're making them look good. You're making their face look good.
Right. Yeah, absolutely.
Dr. Chestnut, thank you so much with Clinic 5C. Absolute pleasure. And thank you for watching this episode of The Curious Bee with Ellen McNamara. More episodes up right now on Fox Local.